Hi, it's Dr. Noel Williams, Optimal Health Associates, December 20th, 2021. COVID update. We're going to talk about boosters. That's all over the news. It's all over everything. So what's the root issue? Well, the root issue, Delta, is here. It's still here. It's hitting the East Coast. It's getting people sick. It's not Omicron. We'll get to Omicron. So the J&J, Moderna, and Pfizer have coverage, but not as good a coverage against Delta. I mean, it's what we all know. So there's these theories that perhaps a booster would be beneficial. The FDA leads to feel that way for universal adoption for a variety of reasons. But an Israeli study came out that, again, was a computer-based analysis of EHR, electronic health records, which showed about a 90% reduction in death if you got a booster. Pretty, I think, average trial at best, observational, retrospective, and to be quite clear, the exact type of studies that the FDA, the CDC, the NIH, and every single umbrella medical group in the entire world has criticized about any other intervention for COVID. But that's what now is the standard when it's the boosters. But there's some role for boosters. I'm gonna get to that. Then you hear a lot about from Pfizer and from Moderna that, their studies show boosters work. No, they don't. And no other papers do either. They just show that in the lab, when you give a booster, there's an elevation in antibody response, and in some cases, T-cell immunity, which is probably more important anyway. But the bottom line is, that isn't the proof that says boosters work. It's a theory, and I'm not against the theory of them being helpful. I'm against this, we have to do boosters, and they are going to work, because there's no data showing that in the world literature. And if they really wanted to show it, Pfizer and Moderna would have done a study. That's here to there. But let's talk about boosters and their potential role. Where do they fit in? Who might need one? Well, let's first start with Johnson & Johnson. Johnson & Johnson's efficacy for Delta is significantly lower with one shot than Pfizer or Moderna. Moderna's the best, Pfizer's second, J&J's third, and it may be as low as 30% coverage. So when you look at that and you have a 70% chance of getting sick with some level of illness with Delta, would there be a role then to add a Moderna and get probably closer to 85 to 90%? And the answer is probably yes, if you're a higher risk patient. If you're a higher risk patient, you're over 60 in a male, over 65 in a female, you're obese, you have medical issues that make COVID more dangerous, heart disease, hypertension, immune deficiency, lung disease, and you've had the J&J, I think there's data now to support the theory of getting a booster. I think that there's theory, but it is just theory. But I think it's reasonable theory for people in that group to get a booster. If you've had the Moderna, I think if you're in a very high risk group, your immune levels are going to come up a little bit more than they were. But again, we get into this esoteria about this. So if you're in a really high risk group, it probably is okay to get a booster, as long as you understand there's risks to getting the booster. And in the end, it's everybody's choice. If you're in the Pfizer group and you're in a high risk group, it's probably a consideration also, or a better consideration than Moderna group. But again, it's all theory. And so these people that are pounding that the boosters are going to be helpful, there's no truth to that, because it's all the same stuff that they have used to criticize. They're the exact same studies, because these are all lab studies showing immune measures that don't necessarily transmit into clinical outcome. But we've left all truth behind. So the summary on the boosters are, if you're higher risk, you're older, you're 65 or older if you're a man, you're 60 years or older if you're a woman, you have high risk factors, meaning you're 50, but you're obese, diabetic, and hypertensive, you have risk factors for more serious illness, you should consider the booster and have a discussion with your physician about it. I think it's very, very reasonable to ask, have a talk with them, see what they say, get your antibody levels checked. There's some interesting data that shows that people with prolonged stable antibody levels probably have pretty good immunity, but that's the group to kind of look at then, because if you have someone who's like mine were 500 after my second dose, 8 months later they were or 490, and then after the second dose they were 480 or this. Sorry, I messed that up. 4 weeks after the first dose, I was at 490. 8 months after my second dose, I was at 489. I'll check them again now this week because I'm a year. And if I'm still around there, I'm falling within a pod that they've studied that says, hey, your immunity level is really pretty good. I wouldn't get the booster because I don't think the antibody number is as important as long as it's elevated and a pretty good number. So that's what makes it confusing. You have to read the science. But this broad brush that everyone should get the booster, I don't think is scientifically valid. I think what is scientifically valid is we want to get everyone vaccinated who hasn't been infected. The problem group remains the unvaccinated. They are going to get sick with Delta, and they will have a greater chance of getting sick with Omicron. So as we go into the Omicron data, again, the laboratory data theoretically shows some benefit to the booster. We have no idea if it does clinically or not. We have no idea really what Omicron's doing. And so to make any hasty decisions for a population of 8 billion people on the planet, to give every single person an intervention that we have no idea if it actually will work or if it's truly safe on a large scale endeavor for boosting doesn't make much sense, when really what we need to do is get people just vaccinated so they have coverage against Delta. So that's kind of the summary on vaccines. I don't know if that helps that much, but again, if you have stable levels long-term, you are probably covered. Getting them even higher, there's the old school immunology data is getting super higher and higher levels of antibodies doesn't necessarily transmit to better immunity. It's about your T cell immunity as much as anything anyway. I mean, look at Kramer from CNN or whatever channel he's on, Mad Money. He and his wife both got the vaccines and both got boosters, and they both got it. They're not that sick, which is the point. But would have they gotten that sick anyway? Who knows? But or the same level of illness. But the point is, boosters are not going to solve this. They're not going to solve it. It's good nutrition. It's taking your zinc. It's taking your vitamins. It's getting your baseline vaccination done. Again, everyone should get their baseline vaccination done who hasn't been infected. Again, I'm not going to go into the whole PEDS thing. Again, we've talked about it. That's a parental choice. I'm not going there any longer. So that's where I kind of am on that subject. I do enjoy the fact, though, that Fauci got on ABC today, because he's just such a clown. Sorry.
And we're pulled.
But because he said that, no, we should probably wear masks forever, because even though the circulation on airplanes are good, we need to take that extra non-scientific step and wear a mask on a plane when we know the number one way of preventing COVID is circulation and air purification. That's what the data shows. If you look at the Michigan data, the COVID rates in schools with or without masks are essentially the same. Again, that's observational data. So that may not be good enough, but since we're allowed to use observational data to say that boosters are always going to work or could work, we should be allowed to say observational data that masks don't work. But, it's okay. Again, there's different schools of thought on all this. I think everyone can look forward to your kids being required to get boosters to go back to college, probably, if you're at a school on either coast, which is disturbing to me, but there's nothing we can do about it. So, that's how it is. So, Kim, what questions do you have for me?
Okay. In your last video, you said something about Omicron being a solution for COVID.
So Omicron could be a solution for COVID is if it turns out to be what the theory is, that it only or predominantly causes mild illness, and it's basically like a watered down flu, and it's massively more infectious even than Delta, and anybody who's not immune gets it. Meaning, because the whole immunity thing, I had a patient in today who got the same Series 2 vaccines as her husband. He got COVID, she didn't. She was with him for 5 or 6 days where he was very symptomatic, never got it, never got checked, nothing, nada. Okay. She has immunity. Okay. She's immune. It works. And so imagine that now her husband, who's gotten Delta, is going to have great immunity for at least a year, and he's going to cover Omicron because Delta is Omicron and Delta are going to have cross reactivity almost always, I think. But the prior infected just don't get sick that much. And so if you ultimately, all of us get Omicron and only get mild illness because we've been vaccinated already, then we're going to have real immunity. And so again, that's what I meant by that is Omicron can be a solution if it causes mild illness. Think chickenpox for you people that are mature enough. It caused mild illness 99% of the time. You felt sick but didn't do anything, and then you didn't get it again. Well, what happens? Omicron could do that for us with COVID. So that was what I meant by that.
Okay. I know you talked about this last year, but it's being talked about again, using a neti pot or nasal spray so the virus doesn't replicate.
I think the number one thing is if you're doing consistent nasal irrigation, your lining of your nasal cavity and up in here, your nasal pharynx, that mucosal surface, which is the moist surface, is more vigorous, strong, and anti-inflamed all the time. And so it's much less likely to get infected by any viral particle.
Okay. So you already answered with if you get Omicron, does it pass over to Delta, and is Delta is there cross?
Delta was a mutation off of essentially Beta. Omicron is a mutation potentially off Delta with something else, and it's thought perhaps it came from an HIV patient or something, but essentially Delta and Omicron are more similar probably than Delta and Beta. But again, I'm not a genomic expert, but that's just from reading papers. But there's a lot of Delta in Omicron. But there's more in Omicron than Delta. There's more different antigens and the spike protein.
So do you think if you get the flu, is there any crossover to that? Are you more likely to get COVID because your immune system's weakened? Anything?
I think if you get sick in general, you're more likely to get any illness, whether it is flu, COVID, RSV, whatever. If you're sick and you're run down or you're nutritionally poor, basically anything that's whacked your immune system already exposes you to getting more sick or sick with another infection.
Okay. What treatments can be done for smell and taste after COVID?
What treatments can be done for smell and taste? Well, in terms of, there are no treatments for smell and taste. There are restorative and regenerative interventions that may help recovery of those. Because treatment is a formal FDA word. So a treatment is something that we used to be able to say, hey, we'll treat it this way. But the FDA has said, no, it needs to be FDA approved to say that, especially in a social media setting. So there are restorative approaches that people use, nutritional, stem cell derivative type products, ozonation, that some practices find success with. So that is definitely, there definitely are things out there. I wouldn't say they're treatments or therapies, but there are some ways of trying to help the body do better and recover.
Okay. Since you mentioned your back, somebody asked, what supplements do you recommend for back pain?
It's always fish oil. It's always fish oil and turmeric. And I actually did get an MRI today because it was hurting enough. And I actually got diagnosed with wimpitis. I just have some kind of minor muscle strain, tear, or ligamental thingy in my back. So I'm officially now, I have back wimpitis, but it certainly doesn't feel like it. But after I got examined by a back person today, they said, get an MRI just in case it's a disc. And no, I have wimpitis. I was so excited to hear that. I was very glad. But it doesn't feel that way. So it's going to get better. It just doesn't feel like it right now.
Okay, and then this person asked, and I'm assuming they mean for COVID, just in with your supplement suggestions. How many milligrams of fish oil per day?
So how many milligrams of fish oil? So basically, if it's a triglyceride fish oil, which is what we happen to carry, which is the gold standard. I know, I'm just kidding. I'm not kidding, but we carry the best products. But it's about 600 milligrams of a triglyceride. It's probably 750 of a a esterified ester type fish oil, and that's your baseline. I mean, since I have horrid cholesterol, I do a lot more than that. I do about 2,100 a day, but I'm more of a worrywart about cardiovascular diseases because I spend a lot of time on them. So, but as a baseline, 1 a day is great for everybody. If you have risk factors, probably 2. And if you are really worried and maybe hypochondrial like I am, I guess, you would take 3. But again, talk to your doctor about the dosing for that. And so if we talk about if you are going to do a booster, and as frustrating as that may seem for us, we definitely are going to have at least one of our children get a booster because of college, who's already been infected. So it just drives me insane. I mean, he'll be on fish oil for, well, pretty much starting right now until he gets it, at least a week to 8 or 9 days later from now, and then for a week or 2 after, and a baby aspirin. And again, that's my personal opinion. You talk to your physician. We don't want anyone getting the booster who isn't on some fish oil and or baby aspirin and we always like an antihistamine for a day or 2 before and a day or 2 after at least. And again, that is not following what the FDA guidelines say. I think the FDA guidelines are wrong because if you look at the Kunis reaction and the risk of heart attack, even with the Moderna, the blood clotting risks with the J&J, you want to do some things prophylactically. It is not going to affect your immune response. But again, talk to your doctor. I mean, you're always allowed to talk to your doctor, your nurse practitioner, your provider. They can give you much more information. I'm like a voice in the wind giving an opinion. Now I'm basing it on science and my goal of not having anyone come to harm ever under any circumstances. So that's the summary. So quick, do you have another one?
Yeah, 2 more.
Okay, go ahead.
Garlic. How do you feel about garlic as a supplement?
I don't really, I think it's fine. It's an antioxidant. It's not on my list of things, but it's totally okay if anyone wants to take it.
Okay, and then why, when a new variant comes out, that's the only thing they're really talking about. Well, you talked tonight about Delta being the one that's getting people on the East Coast sick. But the pattern has been once one comes out, you stop talking about the one before. So does the one before go away?
Yeah, so what happens is when you get a variant, it becomes dominant because it's more especially when it's more transmissible. So Delta was more transmissible than the prior, and now Omicron is going to be more transmissible than Delta. So it is going to infect the people who are able to be infected much more rapidly. The problem with Delta is it got to the East Coast first. I think it probably would have been preferable for Omicron to get to the East Coast before Delta. And there's a variety of reasons why Delta is hitting the East Coast pretty hard now. Some of it's probably weather. Some of it's they're more inside. Some of it is, they maybe had a little delay because they had a higher amount of vaccination. So it had a little slower onset, but now since it can break through vaccination, it's picking up. So that's really probably most of the reasons why. So that's the summary, a lot of information. So again, if you're a high-risk person, older person, think about the booster. Everyone can think about a booster. You can make your own decision. But the groups that I'd be particularly concerned about and encourage a strong consideration for the booster is anyone who's gotten a J&J vaccine with any risk factors at all, absolutely. And then there's theoretical benefit only on any of them. And again, the baseline though is everybody who's an adult should be vaccinated. That's always the gimme, who hasn't been infected with COVID. So, and the effective protection of COVID is probably 98 to 99% at 1 year. Again, that's looking at all the data, not any particular one group of data, but the whole published world's data and finding it and looking at it as much as I can find across all the different countries and locally. So anyway, take care. This is a long post. I apologize. I'll do another one before Christmas. And God bless.